Thank you very much for this opportunity. I deeply want to appreciate the CSJ for including the People's Rights Organization as one of the cluster members to implement improving the realization of the right to health in Nigeria. One thing I've known CSJ for is that any area they delve into, such as budgeting, they will make encyclopedia of it and make practicality of it, and we see to it that if the awareness is created and there is result, concrete results. So I believe God that this one will not be an exception. In fact, right to health, apart from it flows from right to life. Right to life. And if one knows that a developing country like Brazil, in Brazil today, you can Google it, you don't spend a dime. If you are doing fibroid operation, multiple, you don't spend a dime going to any hospital at all. But it's yet, a developing country. Now, in Nigeria today, if you look at the southeast, the issue of hospitals have been more like privatized. If you come to Imo State, where the former governor built 27 hospitals, gigantic hospitals in 27 local government areas. But today, it is now commercialized, and if you go to, if the people are sick, you now help yourself with the private hospital, which are pretty very, very expensive. For instance, this morning, I told Eze that I was going to a clinic. I felt somehow, before you say Jesus is Lord, they gave me three tablets or something, and it was 20,600. I had to transfer it immediately. I mean, so what if, for instance, I don't have that money? I spent like 30 minutes in the clinic and I transferred. So now what we're saying now is that the time for us to ensure that whether by way of advocacy, carry stakeholders along, to see that we prioritize the right to health of Nigeria, because it's a fundamental right. And in fact, it should be domesticated seriously. And I don't know why the National Assembly should not put right to health as a fundamental right. And we have that access and all that. So, on behalf of the People's Rights Organization, we pledge to religiously and diligently ensure that the mission, the objective, and the vision of this project is fully realized.